This is the first time the state has reversed course in any of our communities and gone back to tighter restrictions. But the governor says with the dramatic rise in cases in Utah County, an intervention was necessary. News specialist Jed Bowl joins us live with the details. Jed?
Yeah, Deanie, the state today told the cities of Orem and Provo that they would have to dial back to the orange restrictions, which are the moderate restrictions, and that goes into effect tomorrow at midnight. That means that people have to wear masks in public. They have to make sure that they don't gather in any groups over 20. And they're also asking everybody to stay at home as much as possible.
And we have seen cases increase across all adult age groups in the past 2 weeks.
Statewide, 15 to 24-year-olds still have the highest case rates, but they're not the only ones being impacted by the coronavirus spike. The State Department of Health is seeing significant case growth in 12 of 13 health districts.
And Utah County is continuing to be the main driver of this statewide increase.
Right now, Provo and Orem account for nearly 60% of the cases in that county.
In some areas of those two cities, you are between 3 and 6 times more likely to have COVID-19 than the rest of the state.
That's why the state is moving both cities back to Orem.
Intervention is needed. And so that's what's taking place here today. And I certainly believe a little pain now will be a lot better than a lot of pain later. So this is an inconvenience. We recognize it.
Taking action now to prevent hospitals from being overwhelmed. Right now, 161 people hospitalized across the state due to COVID-19, up from 115 a week ago.
But what we're starting to see is that spread into older populations that are at a higher risk of hospitalization, and that's why our hospitalization numbers are going up.
The governor says the greater concern among our hospitals now is not necessarily bed space, but personnel.
We don't want to have our healthcare system overwhelmed. We've seen that in New York and other places where they didn't take care of that. We're making sure that doesn't happen here in Utah.
The governor said today that the state is working very closely with public health officials in Utah County in order to get the dial back to yellow as quickly as possible. He told me that Utah County is considering a mask mandate and that the state would support that if the county went in that direction. Guys?
All right, we'll cross our fingers and hope in the next few weeks we get a control on that. Thanks, Jed.